Hey there. Yes, pelvic PT may be able to help patients with erectile dysfunction. However, before I go into why, it's important to note that erectile dysfunction is one of the first signs of heart disease or any sort of cardiovascular issue going on. So if I'm the first person that patients see before they've seen a physician, I always recommend that they go get cleared, checked out by their primary or their urologist or even a cardiologist to just make sure that everything in the ticker is working okay. However, if it's not a vascular issue and if it's not a hormonal issue, it could be a function of the musculoskeletal system. And so if that's the case, when we're talking about the pelvic floor and people with penises, I always like to give this closed fist analogy or the clenched fist analogy. So if you're watching this, I want you to squeeze your hand as hard as you can. Squeeze, 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 squeeze. And then you let it go. You see how my hand was red and now it's slowly refilling with blood where all these white areas are. That same principle can be applied to the pelvic floor. And the pelvic floor are also muscles that have the ability to contract and relax. And one of their main functions is to pump blood and fluid in and out of the pelvic cavity. And so if your pelvic muscles are stuck in a clenched fist all the time, and they're not able to contract and relax to pump blood in and out of the pelvic cavity, it's likely that it's having a hard time pumping blood into the penis, and that may be inhibiting the ability to get an erection. So if a patient has these myofascial restrictions, therapy can help both with internal work and external work, as well as exercises and stretching and mobility work can help to open up the pelvic cavity to allow more blood flow into those muscles and into the tissues. So something else that I've also been using in the clinic to help with ED is something called shockwave therapy. That's that device right there. There's a lot of information out there on shockwave therapy, but this is the one that I use, and I've been getting a lot of really great results with it. I'm going to save an explanation for shockwave therapy for another video because there's a lot to unpack and there's a lot of misinformation out there. Myself and some colleagues of mine have done a lot of research to really sort out this information, so I'm not going to go into it now in this video, but it is something that I use both for pelvic pain, chronic pelvic pain, and erectile dysfunction.